Okay, so tell me a little bit about yourself and how you got involved in the physical therapy realm.
Sure. So my name is Erin Perez, and I am an assistant professor at the UT Southwestern School of Physical Therapy here in Dallas. I've been a PT now for I guess about 12 years, which seems like a long time. But I originally got into PT, I think how a lot of people do, which is that I was interested in sports and athletics. But my mom actually had a brain injury when she had a brain tumor when I was in elementary school and then a brain injury when I was in college. And so, as an offshoot of that, kind of seeing her go through rehabilitation, that sparked my interest more in sort of the neuro aspects of physical therapy. And that's eventually what I entered into in terms of physical therapy areas of practice.
Hmm. So what sorts of things do you do as a physical therapist? Because I know there's different branches and different stuff that physical
Absolutely.
therapists work on.
Sure, absolutely. So I am a neurologic clinical specialist in terms of treatment. So my primary areas of interest in the physical therapy world are individuals post spinal cord injury, brain injury, and stroke. So that's where most of my clinical experience is as a PT. I worked several years in outpatient day neuro brain injury rehab. And then I'm also, so I currently I treat an outpatient neurologic practice. So in addition to those specialty areas, I also see patients with the diagnoses of multiple sclerosis, Parkinson's disease, and then a fair amount of individuals with functional neurologic disorder and those individuals that just have balance impairments and or falls. So I kind of see a wide variety. And then in addition to clinical practice, I also teach quite a bit in our physical therapy department. I teach some of the neuro content, and then also I am over our neurologic physical therapy residency. So we have residencies just like physicians do, where people who are licensed as PTs can go on to specialize in an area of practice. And so we have a neurologic residency at UT Southwestern. So I coordinate that. And then also I'm over clinical education experiences for the students in our DPT program.
Hmm. So how do you go about addressing an individual's needs? What sorts of things do you look at?
Yeah. So when seeing a patient, I think the biggest thing to me is to really get to know the patient at a little bit deeper of a level. So to me, when I'm thinking about a physical therapy treatment plan, I want to know, what is it about the patient's current functional level that keeps them from most enjoying and being engaged in their life and the activities that they want to do. So when I'm doing an initial evaluation with a patient, I want to know things like what are their interests? Like what did they used to do? If it's an injury that they recently sustained, like what kind of things did they like to do before their injury? And what do they want to get back to? Because oftentimes the PT serves as sort of an intermediary between like what the patient brings to the table in terms of their physical function and what they want to do. Like sometimes it's not super intuitive as to how you might do things in a modified way if you have physical disabilities. So for me, I really want to get to know the patient's goals and what's important to the patient, because I can certainly choose a treatment plan for a patient, but it's more meaningful if the patient tells me early on what is important to them and what they want to improve. And then that's kind of where we'll take the treatment plan from there.
Hmm. If I could ask like a follow-up, like what do you do from a physical therapy perspective to make sure that individuals have, the independence,
Mhm.
freedom, autonomy, what have you, to really, you know, basically be more free, be more independent and have that freedom in their lives?
Yeah, so that's a big part of what we do as physical therapists. I think it depends on several things, of course, it always depends. I think one thing it depends on is the patient's prognosis for recovery. So, we have some patients who come into us with deficits that we can treat through therapy. So, an example of that might be like an individual who is falling because of perhaps like some sensory abnormalities in their feet, like due to neuropathy or something like that. And so maybe as a result of that, they don't go out and do things that they may have used to done with their family, like go to the fair or go to a kids or grandkids baseball game because they have to walk over uneven ground, you know. So in a situation like that, we're going to tailor our treatment activities towards um, putting the patient in those types of situations in therapy where they're safe because we're guarding them and we have, you know, mechanisms in place, and we're going to up train their ability to participate in things. So if that's something like walking over uneven ground or balance challenges, like we're going to really try to train that patient and increase their confidence and their physical ability to control their balance. So thus they feel more comfortable and confident going into some of those situations. Now, some of our patients don't have the luxury or the ability, you know, to return to a more normal level of physical function. And in that case, what we do as PTs is really look at our ability to implement different adaptive equipment in order to help facilitate participation, and or looking at maybe modified ways of doing things for that individual. So an example of that would be a patient that comes to me, perhaps who walks short distances, but it's very fatiguing for them, and or maybe they're falling when they're walking, and their deficits are such that perhaps they're not going to make significant improvements because maybe they have a progressive disease. So in that case, you know, we may look at walking aids like you know, a walker or a cane to give them improved stability. We might look at bracing. So, you know, like an ankle foot orthosis to help control the foot when the patient gets more fatigued. Or we may look at something like power mobility or a wheelchair, taking into mind those patient specific factors, like what kind of you know, resources do they have to transport a wheelchair, or can their caregiver load a wheelchair in and out of the car? So taking those into consideration, we might look at something like powered mobility or a scooter, or even just a lightweight manual wheelchair that they'd be able to propel so that they can go to some of those longer distance, more physically challenging environments in a way that they're safe.
Mm-hmm. My next question is, what impact does physical therapy have on the disability community? What sorts of stories have you heard from patients that you've worked with?
Well, I think I've heard good and bad things. I think most of my experience has been with individuals who have sustained spinal cord injuries in terms of talking about these kind of topics. And one thing that I've heard from those individuals are things like, well, your therapist will teach you to do it one way. And then when you get home, you know, you'll figure out a different way to do it on your own. So I think sometimes in some ways therapists get maybe a bit of a bad rap in terms of you know, knowing the textbook way to do things, the textbook way to transfer and mobilize, but then maybe being a little out of touch with maybe how patients with disabilities actually end up doing things. And so I think, you know, to answer, I don't know if I'm exactly answering your question, but I think as PTs, we are obligated and have the responsibility to understand maybe not only the way that we learn how to do things in textbooks, but also to be integrated in the community of people with disabilities to understand how they do things. And I think that's where things like peer mentorship and other people who have lived with disabilities longer than the individual you're working with are very important. Um, but
Mm-hmm.
but in addition, I think PTs are often, like I said before, that intermediary between what a patient wants to do and what the patient brings to the table physically. So I think the role that PTs really are able to play is we're able to really reach out to those, we know have relationships with those equipment vendors, and being able to look at the patient and say, oh, you know, hey, I had a patient that had similar deficits. They got a scooter and it really improved their function. Then we can reach out to, you know, that individual who sells the scooters or who, you know, fits someone for a scooter or a power wheelchair, and then we can kind of facilitate that relationship. And really the aspect that we hold in that relationship, or the role we play in that relationship, is understanding the patient and the patient's physical deficits. And then that equipment vendor might come in and know more about like what specific equipment the patient could qualify for and how the insurance might work to fund it and that kind of thing.
Mm-hmm. Lastly, how can physical therapy, create better outcomes for people with disabilities in the long run?
Yeah. Um, I think, okay, let me think about this just a little. I think the key to improving outcomes in the long run goes back to what I said initially, which is that we have to listen to our patients and understand truly at not just a surface level, but at a deeper level, what our patients want to do. But at the same time, having a knowledge of, like I was saying, an integration into a community of individuals with disabilities where we can see, because as PTs, new equipment and new technologies are coming out constantly, and it's really quite difficult to stay abreast of all the different things that are coming out. So I think integration into communities of people with disabilities is a good start, because then you get to see kind of the options that are available. And in entry level PT education, PTs often aren't, don't get a whole lot of education in all the different adaptive devices and technologies available to patients. And so I think part of it is integration into communities where people are disabled and do use that kind of adaptive equipment, but also just personal study and taking courses and understanding sort of that technology that helps bridge those gaps. And then also having that deep relationship with your patient where you understand like what type of activities they want to get back to and what their goals are. So the working knowledge of your patient and the working knowledge of the equipment available, if you have both of those things as a PT and are able to match those two, I think that improves outcomes more than anything else.
Mm-hmm. Yep.